Hello, my name is Farhad Ravandi. I'm a professor of medicine and chief of section of acute myeloid leukemia in the Department of Leukemia at the University of Texas MD Anderson Cancer Center. And we are going to talk about whether it would be possible to treat patients with acute myeloid leukemia with oral agents or oral tablets. And just to set the stage, AML has been generally treated in the past with intensive chemotherapy in the form of typically cytarabine and another drug, typically idarubicin. These are chemotherapy agents that are given through the vein in a catheter that is put in the arm of a patient. Of course, this has been the mainstay of therapy of patients with AML for several decades, and it does have its problems, particularly for the older patients. Now, the median age of patients with AML is in the upper 60s. So in general, majority of patients with AML are older than 55 and 60, and at least half of them are older than 68 or 70. So this is a disease of the older population, and the chemotherapy that I mentioned has not been well tolerated in the significant proportion of the older patients, mainly because older patients develop cell toxicities much more often in general, and this is not a universal statement, but in general, older patients have other medical problems like heart disease and lung disease and kidney disease and liver disease. And because of that, chemotherapy drugs that are administered through a vein and are associated with significant toxicity have not been well tolerated in the older population. So a few years ago, a new agent or a new drug called venetoclax came to be approved in AML in combination with other agents, which are either decitabine or azacitidine. These two are very similar drugs, so one or the other is combined with this drug venetoclax. And venetoclax is an oral agent. Decitabine or azacitidine are still administered by vein. So this combination is much, much better tolerated than the traditional chemotherapy. In fact, it has been essentially a revolutionary combination in treatment of patients with AML, and particularly older and unfit AML patients. This combination has now been approved by the Food and Drug Administration for treating older patients with AML. And in general, it has been very well tolerated and has led to significant improvement in outcomes of older patients with AML, with median survival of close to 15 months in a very large multinational study. Many patients actually do even better than that, and I have patients who have been doing well 3, 4, or 5 years beyond therapy. So, of course, this has been a major revolution in treatment of AML, and at the same time, there has been also other major advances. Several other oral agents, drugs that are taken by mouth, pills, that have been developed and FDA approved. These are target-specific agents, so they only work in specific subtypes of AML, which have their specific targets. For example, there is a drug called gilteritinib, which is targeting a molecule called FLT3, which is present in about 30% of patients with AML. Another agent called enasidenib, which targets a molecule called IDH2, and this is also present in about 10% of patients with AML. Another oral agent, ivosidenib, is targeting a molecule called IDH1, which is also present in about 10% of patients with AML. And there are also other new target-specific drugs that are being developed. For example, a group of drugs called menin inhibitors that are being developed that target a specific abnormality called MLL translocations, which are present in about 5 to 10% of patients with AML. So you can see that there's a large number of oral tablets that are being developed in AML. Now, I mentioned earlier the big revolutionary development in AML, which was a combination of decitabine or azacitidine plus venetoclax. And I mentioned that decitabine or azacitidine are both drugs that are given through vein, so they're still not oral agents. However, there's also been a development that we now have oral formulations of these drugs being developed. So Aztec 727 is an oral agent, which is an oral formulation of decitabine that is actually approved by the Food and Drug Administration for treatment of patients with myelodysplastic syndrome, a condition that used to be called pre-AML or precursor to development of AML. So this oral agent actually is very effective in MDS and is approved in MDS. It is being investigated in AML. It is as yet approved. It is not approved in AML. But you can see that if we establish that the combination of Aztec 727 with venetoclax is as good as the decitabine plus venetoclax, which we will have a completely oral strategy in AML. The trials looking at this are ongoing. I do not recommend you to go and ask for these from your local doctor because, again, it's still not approved and is in the clinical trial setting. But if you can participate in the trials that will be ongoing, that will help to establish this strategy as an oral treatment for acute myeloid leukemia. Similarly, we are combining the same drug, ASTX 727, and venetoclax, and gilteritinib, another drug that I mentioned earlier that was target specific in that specific population of AML patients. And again, this is only in a clinical trial setting. We need to establish the appropriate doses, so this should not be done outside a clinical trial. But I also, again, I recommend you to seek clinical trials because that's the way you can get these latest and most novel treatment strategies for not only AML, but also other cancers. Also, there will be trials combining the Aztec 727 and venetoclax with the other drugs that I mentioned, like ivosidenib or enasidenib. And again, this is only available on clinical trials, but you can see that that shows that there may be a future in AML therapy if we establish strategies as being absolutely safe and effective, that we can actually treat our patients with oral agents. And that will help many, particularly older patients, because of the convenience. Although it is very important that, with oral agents, we have to be careful that the patients actually receive the correct doses because they're doing it at home and with limited supervision. So these are issues that have to be resolved before this can become a widespread strategy. Other oral agents and oral formulation of azacitidine, which was the other drug that I mentioned to you earlier, that is currently given intravenously or in the vein. Have also been developed a drug called CC486, and this agent is actually already approved by the Food and Drug Administration only for continuation of therapy. So this is not for initial therapy, but for continuation, a sort of maintenance strategy in patients who have achieved a response to initial therapy with chemotherapy. This can also be potentially combined with other agents like venetoclax, and clinical studies looking at this are ongoing. I think the advances in medicine are the same as advances in technology everywhere. We see that we now have better drugs, and we also have better tools for detecting any residual disease or residual leukemia. And with these assays, we can become more and more confident if we have completely got rid of all the leukemia in the patient's body. And maybe in the future, we will have a potentially curative oral strategies for the majority of patients. But this necessitates investigating these agents and clinical trials, and that's why I would encourage any patient with AML to participate in clinical trials, because that's where you would potentially receive the best and the most modern treatment strategies.